Hey everyone, we got a lot of great feedback on our last video about how we were able to answer a lot of your questions that we received in and talk a little bit more about what we do at the health department as well as through other departments throughout the county to be sure that we're as prepared as possible and doing what we can for you guys. So I'm going to go through some of the other questions that have been submitted to us since then. And I also have my nursing supervisor, Clarissa, with me. She has been on the front lines working day in and day out, almost all day long, most of the time. So it's been a long road for us, but it's been a good road, and we've been able to learn a lot and really make things happen for you guys. So she's going to be talking more towards the end of this about how the nursing clinic runs through these processes and a little bit more about the interactions that we have with the patients as they come in and go through some of that testing procedure and just give us some good insight on how that goes so that you will know. The first question that we got in was pertaining to the stay-at-home orders and particularly as it applies to child custody. So first and foremost, we are not an attorney's office. We're not a legal entity. Through Executive Order 121, it states specifically places of residence can go back and forth too. So it says that you can travel between one's place or places of residences for purposes including but not limited to child custody or visitation arrangements. And then the FAQ document that was sent out through North Carolina State on Executive Order 121 says that individuals should not visit with friends or family members if there is no urgent need. So we definitely understand where there's some confusion where that is. In speaking with some attorneys on the situation, trying to gain some insight, overall, we would definitely recommend that you speak to your attorney about that and kind of see where that is, especially across state lines, because that is still something of concern. So we definitely recommend that you just reach back out to them if a co-parenting agreement can't be made to maybe adjust time on the back end when this ends. But just be mindful that, usually what's in the best interests of the child and their health is what's going to be most important to us. So the second question that we got is talking about how long the virus can live on surfaces. And we were able to find the most up-to-date information was listed on March 17th. And studies up until that time say that there's very strong evidence backed by the National Institute of Health, the CDC, UCLA, and Princeton University that publishes in the New England Journal of Medicine. They're saying that the virus that causes COVID-19 will last in aerosols for up to 3 hours, up to 4 hours on copper, up to 24 hours on cardboard, and then 2 to 3 days on plastic and stainless steel. So when you're thinking about cleaning products, when you're thinking about even handling money, things of that kind of nature, just use proper protocol. And if you need to use gloves, that's definitely something that would be smart, especially if you're immunocompromised. The third question that we received was talking about what does mild symptoms mean? What are severe symptoms? So when you're looking at a mild case definition, you're looking at runny nose, a sore throat, tiredness and fatigue is something that's fairly common, and then of course a cough. When you're looking at a more severe case, that's when you're thinking more lower respiratory issues, difficulty breathing, and then a long-standing fever, because that's not a good thing either. So that's the difference between a mild symptom versus a more severe and strong symptom. The fourth question that we got was talking about, do you retest positive cases before letting them go back to resuming normal activities in the community? And Clarissa's got a lot to kind of show you as far as that process goes. So I'm going to let her take over from here.
So first, let's talk about how the process is initiated to begin with. Individuals who meet qualifications for testing, they'll be considered what we call a person under investigation. So this is our PUI form. We collect basic information like such as if you're experiencing any symptoms, when did they start, how long have they, lasted, or are you still having them? Any travel related questions and questions related to your potential exposure. If you have been around a positive patient, was it a household contact, maybe a community contact? If you're a healthcare worker in the healthcare field, was it a contact in that way? The final page, this one is more detailed as far as symptoms and any previous medical history that you may have, both of which, if your results do come back positive, this information is input into what we call the North Carolina Disease Surveillance System. So the state has access to that, so they're able to look at information like this and help them with, their studies and stuff like that as far as the different symptoms that seem to be going along with this disease. As far as the question integrating back into society, after the appropriate quarantine period is completed, there are state guidelines that you can see here, Stephanie has on the screen, that basically talk about people who have mild symptoms that consist with this disease and they're able to recover at home. They're looking at the 7 days since symptoms first appeared and the at least 3 days past recovery without taking any fever reducing medication. And notably, these patients do not need a negative test result to document recovery if they're meeting those clinical criteria. Now, it can be different for patients who are immunocompromised or requiring hospital admissions. Those will be directed by the healthcare provider, household members, and other close contacts. This is why we recommend anybody who is a PUI, who is being tested, who's suspected, they recommend for the household contacts to stay at home for the 14 days, just for proper precaution to make sure everybody's well taken care of.
All right, so we hope that that clears up some of those questions that you may have, and we're thinking maybe middle of next week we can do another one of these. So send in those questions to the Facebook Messenger portion that we have on the health department's page, or you can also give our give a call to our line that we set up. It's the health department's number, 828-389-8052, and the extension is extension 110. Go ahead and leave a message. We monitor that still quite often and update that line with what is going on in Clay County to keep you guys as informed as we can. So you guys have a great day and a good weekend, and we'll talk to you soon.